I'm going to call to order the September 5th meeting of the Barnstable County Commissioners, and I would ask you to rise and join us in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And please let us take a moment of silence to remember all the men and women who serve our country, both here and abroad, and especially for those who have given their lives. Thank you. So first on our agenda is public comment.
Question. Assembly of Delegates, they meeting at 3:30 is posted on the bulletin board or 4.
I have no
It's on the
idea.
internet.
We had no idea for that. You'd have to check with them.
They normally meet at 4. They could have some committees that meet at 3:30, but I'm not sure.
I believe they're doing a finance committee hearing, governmental regulations at 3:30.
So it's a committee
At 3:30.
at 3:30, but their meeting begins officially at
The
4.
regular meeting
That's
is at
what's on the computer.
Okay, is there public comment? Anyone who'd like to address anything that is not on today's agenda? Okay, hearing none, then we will move forward with a presentation of the Suicide Prevention Week proclamation by Maura Weir from the Cape and Islands Suicide Prevention Coalition. Maura, welcome to you.
Thank you.
Would you like to sit up in the front row? So, and Beth? Albert, our Human Services Director, and Kathy Cullen.
He's going to take a picture. Hopefully you'll allow it.
Sure.
For you.
Can I come right here?
Get my desk side.
I just say the same.
Yes, I might add that Commissioner Lyons will not be here today.
Thank you.
She had a conflict. Okay.
Thank you for having
Maura,
us.
yes.
Yeah. Would you like me to read the proclamation?
Yes, that would
Okay.
be nice.
So my name is Maura Weir, and I'm on the steering committee of the Cape and Islands Suicide Prevention Coalition, and I'm coordinating some training and events for the coalition's Cape-wide for the month of September for Suicide Prevention Month. And in front of me, I have a proclamation for Suicide Prevention Week, and I'd like to read it out to you folks if that's okay. So it just says Suicide Prevention Week. Whereas in the United States, one person completes suicide every 16 minutes, and whereas suicide is the third leading cause of death for adolescents and young adults in Massachusetts, and the suicide rate on the Cape and Islands is 1.5 times higher than the state average, and whereas suicide is a most tragic and disruptive event for families and communities, it is estimated that there are 5 million survivors who have lost a loved one to suicide. And whereas suicide is a public health issue, it is a community problem, and through education and awareness of the issue, a great number of suicides can be prevented. So I'd like to present this to you, and you could read the last bit that says that you designate the week. Thank you.
Therefore, we do hereby officially designate the week of September 9th to the 15th, 2012, as Suicide Prevention Week in Barnstable County. And we so affix the signatures of Bill Doherty, Mary Pat Flynn, and Sheila Lyons. So that's great. You do such great work, I must say, truly. And I know next week you have a meeting coming up. Where is it, on the 13th?
Mm-hmm. Yeah, our next coalition meeting is next Thursday, September 13th, and it starts at 11:15 and goes till 12:45, and it's right here in this room in 11 and 12. And we'll be doing a small ceremony outside on the steps to commemorate Suicide Prevention Week and honor those that we lost to suicide.
Great.
So, and I wanted to just draw your attention to, obviously, the packets of information that you have before you that the coalition put together. As you know, I co-chaired the Cape and Islands Suicide Prevention Coalition. We prepared this packet of information for all of our elected officials. Inside there is a fact sheet which our department just recently released, Christine Clemenstein. So it summarizes all the data on suicide deaths specific to Cape Cod and the islands, because it is a regional coalition. So I just wanted to highlight, alert you to that this information's in there. It will be posted on our website. And we provided you with the suicide prevention pins, which if you could wear them next week, that would be great, or whenever, but I know Bill, I've seen you wear
Yeah,
yours.
it's on my jacket.
And if there's any of, also in this packet of information, there's a calendar of events.
On the
If you can
13th,
make
what is
any
the
of them.
time? You have this-
11:15 to 12:45 here.
And as Maura said, we were gonna do a little ceremony outside to commemorate.
Just
I'd be-
before
I'd
that?
be happy to join you.
During the meeting time.
During the meeting.
Probably close to the beginning. Okay?
I'd be happy to join you.
Yes.
Great, thank you.
And I've already put the meeting on my calendar too. Next week.
Great, thank you. There are several events all over the Cape, so if you look at the calendar events, you can choose to come to another one if you so wish.
Well, I think in terms of achieving the awareness and the involvement of the community has been such a strong objective that the coalition has had. And this really takes it to a whole new level, having, designating the week and having events like this, and that people can attend and learn more.
Right.
So
Great.
for people who may be viewing or will view, is there a website that people can go to and get this
Yes,
information?
all of the information is posted at www.suicideispreventable.net. It's on the back of the calendar, as Kathy just pointed out to me. And you can also contact our office at 508-375-6628. Kathy has all of this information and would be happy to send it out. Also, just quickly, because I know you have a full agenda, the coalition did just produce a new brochure called Could It Be Depression? And it's specifically geared to older adults. And we just had several thousands of these printed. And I can't remember the exact number. 2,000 printed, and we'll be disseminating them to all the councils on aging and other groups that work with seniors. And this was something that the coalition's been working on for a while, and it came out of a request that we target something for seniors, because a lot of times depression is what a physician or family member may see. So.
Included in the young adults, yesterday, I had the opportunity to talk to, I serve on a committee at the Massachusetts Municipal Association, and the subject of veterans and services to veterans came up. And they were kind enough to support seeking a commission to be convened to look at not just the reimbursement of the towns, which was the primary reason they brought it up, but also to look at enhancing veterans' benefits to include the responsibility that we have to do more to reintegrate veterans who have been coming back from deployments back into the community. I pointed out to the other members that were representatives of municipalities from all over the state how often it is that about a year out that these young adults, mainly young adults who have come back, have not only demonstrated suicide ideation but have been involved in completions. So they did say that that they would support that, but this whole issue is an enormous societal problem and one that deserves a high quality of attention. And thank you for for spending the time and energy on this. And I certainly would be there to at least lend my presence to how important it is to give attention to this going forward. Thank you for doing that.
Thank you.
Thank you.
Can we just get a picture? Or is
Yeah,
it-
you can get a picture.
Do that, yeah.
And how would you like to take it?
Standing or sitting?
You want to do it with the
Will you sign
proclamation,
it?
or
Yeah.
somehow? Yeah.
No? Oh, come on, let's
Come
stand
on.
behind. Come on, come on.
We could ask
You're
advice
small,
from the
steady.
professional in the back there as to how this should be said.
Really? We'll just do a quick,
No,
quick
no
picture.
advice?
Great.
No advice?
oh, do I need to stand in this?
Yes.
You're short.
I would say that the young lady in the green that would be handing it to you.
Okay.
There you go.
Is this good?
That's good.
Take one. Okay.
Good luck.
Just to make sure.
Another one?
Go by me.
Oh, yes. Here we go.
Thank you.
We're good.
Okay, Thanks, Mark.
Okay, we'll talk later. We'll talk later. I just didn't hear from anyone over there.
You haven't?
In Gosnell is there?
Well, I wanted to mention the work that Maura and Beth did in Falmouth. I think it was about a year ago, September, when we began to experience a number of suicides. And the coalition came in force and worked with a lot of people from the town and the community in really helping to, I know, that's really helping to help the community know how to handle and deal with that and do whatever it could to prevent it. So that was a really good effort.
Thank you. And we've used that model, taken it to other towns, and actually we also took it to Bridgewater off Cape because they were experiencing some issues. So it's a really good collaboration with the Department of Mental Health.
I wanted to ask you, and in terms of suicide do you mind sitting for just another minute?
No, I feel funny standing there.
Yeah.
We'll sit down.
I'm just thinking about, in terms of the economy, you know, how much of a role does the current circumstances that people face with job loss and unavailability of jobs and being younger and supporting families and all that, what do you see in that part of society that must be very troubled by the times in which we live?
You can help with it too, but it would be speculative. I mean,
And no,
some
it's
of it's
speculative, right.
speculative, although there
So,
has
but the
been-
research does show that any times of war or bad economics in the country, that the suicide rates increase, and also long-term unemployment is highly correlated with suicide, and that has something to do with how they feel about themselves and not being able to be more effective and stuff or productive. So all the research points to that at the moment, that what's the word I'm looking for? The unknown, not knowing when you're going to get a job, when you're going to, have your next meal and things like that.
So I think the work that you do with employers and with healthcare providers and doctors' offices and all of that just helps them be more aware
Right.
of when their patients present themselves, that they keep that in
Well,
mind.
you raise a really interesting point. I mean, what the research shows and what we know is that there's oftentimes, when someone dies by suicide, there's a lot of complex things going on, and it's not usually one event. So there could be underlying depression, untreated mental illness, substance abuse, in addition to a loss of a loved one, a loss of a job, a brush with the law, loss of a house, foreclosure. So it's usually several factors happening at once in a person's life, and it differs for every person. But I think you're working with employers. There is a workplace mental health initiative that we had actually brought to 3 of the chambers on the Cape and had worked with them last spring. It was Mashpee, Falmouth, and Bourne. I hope I got those 3 right. It was Mashpee, Falmouth, Bourne. And actually put on an afternoon session with workplace mental health professionals with employers, and it was very helpful. And as a result of that, I actually went out and did some follow-up trainings at some of the bigger employees on the Cape Cod Healthcare, Shuckley, and there was one other. So I think that you raise a really good point. It's something that we need to continue when we do outreach, and more is coordinating some trainings for the coalition, that we do reach out to employers. So.
And I just want to make one more point, and then I'll stop, because I could talk about this all day. But suicide happens a lot on Cape Cod, and nobody really knows about it. And there's some sort of stigma attached to someone that might die by suicide or want to die by suicide, or their family. And we do have 1.5 times higher rate than the rest of the state. So there's definitely some stuff we need to do here to talk about education and awareness and prevention and action. And the other thought is, we might never hear about them, but they still happen. Only if it's a high-profile suicide do we hear, or we try to chase, to find out what town it happened in. But, probably 2 or 3 a month at least on the Cape.
So what we've organized to address that, just to respond to what you're saying, in 2 ways. One of the things the coalition is looking at is a public education campaign around encouraging help-seeking behavior. We don't know if it's stigma, we're not really sure why people are not seeking help, and if they are seeking help, why are people still dying by suicide? So that's one thing. The other thing is we have organized with the Department of Mental Health, we have a post-vention response team. So if we become aware of suicide, and we have gotten the word out there, and we continue to kind of beat that drum, because a lot of times, you're right, we hear about it, someone calls me, I hear about it, it's reported to the Department of Mental Health, but we do have a response approach that's coordinated, that if there is a suicide, specifically more than one or two in a short period of time, we can reach out to that community. In fact, we just had a meeting the other day. So there is that post-vention, as we call it, response, which is really important in prevention work, because you have to reach out to the first circle of survivors in the community who've been affected, because it can be devastating, and it's definitely impactful for survivors.
Yeah, well, I think we're all recognize that there's a lot of stressful events that occur, and we can't help being exposed to stress, but we can help how we respond to it. And perhaps one of the things that we need to emphasize over and over again, that we are not completely responsible for dealing with everything that we're presented with, and it's no weakness to recognize the opportunities that are available to reach out to get what I would call professional support and help. And there is that, and I believe that one of the things that that you're doing is to provide an avenue that would be a conduit to get to that professional support and help that would lead you through a stressful event that might lead to, especially in the case of someone who has a diagnosed mental illness, that would lead to decompensation because of a precipitating stressful event, and then perhaps.
Well said, well said.
So hopefully, we'll.
You should sign him up.
Yeah, I think we should. It's okay to ask for help is really what
Exactly.
we're trying to say.
Right. Thank you.
Thank you
Thank
very
you.
much. Yes, we'll
Okay.
see you next week
Okay.
again.
Yes, we will.
Okay.
Good, great.
Thank you.
Thanks.
Thank you.
We have a few minutes so we can approve the minutes of the previous meeting. I can find mine. Yes.
I have one more additional transfer from Sunday.
Okay. The minutes of August 22nd.
Yeah, you had one right in front of you.
That's a while back, 2 weeks ago.
The minutes were distributed electronically.
Yeah.
I don't think there was a hard copy here.
Okay. To the best of my recollection and belief, I didn't have any questions on the minutes. I believe I was in attendance in that meeting.
I believe.
You were,
Okay, then I'll
yes.
move them.
I'll second. Those in favor say aye.
Aye.
Opposed? Unanimous.
Any summary of action?
Yes, do you have, I had some questions. Since I looked at them electronically and I didn't mark them, I wanted to ask about, it's going to take me a minute to find, the payroll benefits coordinator. There's a plan to change is it just the position title, or is it also some of the responsibilities for that position? It's under 9C.
Yes. I don't know why it says change in position title, because that's what, as you know, our current payroll administrator has resigned. She's moving to South Africa.
Yeah, I heard that.
She sold her house, so we're filling the position. So I couldn't tell you why it says and change in position title, because it's essentially the same position and doing what they're
The
doing.
responsibilities are the same.
Correct.
So there's no change in grade or
No.
anything?
No.
Now, and then under F, I remember in the budget, we talked about a temporary position. Now, is these permanent positions, is this due to a vacancy, or is this due to this
I
new
believe-
contract that we have with the
I
town of
believe it
Wellfleet?
helps,
It's related to that?
fills in with the wealthy contract. That's
Okay.
correct, yeah.
And oh, I see the I know that the EDC is meeting tomorrow, and I think they're gonna have the final pieces to their contract with Acela. I think that's how you say it, Axela or Acela. The company that they hired to do the review
Inventory.
of the inventory
Yeah.
of technology
I know they're
capabilities.
working diligently
Yeah,
at it.
they are.
Yep.
Yeah.
So I know I just received an update from John Morris on their status, so, and I know they had quite a few complete already, so.
Okay, and the other one is number 5, the connection strategies for wastewater planning. Is that through the
It
collaborative?
says Connection Strategy Incorporated.
Yeah.
Yeah.
It's through the Cape Cod Commission, if you see,
Oh, through
they're
the
all
Cape
listed.
Cod,
under the
it's under Cape
Commission.
Cod
Yep,
Commission, okay.
yep.
Okay, those were all my questions.
All right, I'll move them.
I'll second. Those in favor say aye.
Aye.
Opposed? Unanimous. Okay, now we're going to move to a discussion of the Hoarder Task Force update.
Okay, I want to make sure that they didn't talk to my wife first about this.
How about me?
That's what they talked to Dick.
I'm not a hoarder. At least I say I'm not. Hi.
Hello.
Lee Manillo.
Yes.
Yes.
Hello.
Hi.
Hello?
Hi.
So maybe you could introduce yourself for the
Sure.
people at home and
Absolutely.
and tell them what you do and why you're here.
Great. My name is Lee Manillo. I work for the Barnstable County Health Department. I've been with the county for about 10 years. This is Erica Woods. She's the Assistant Health Agent for the town of Orleans. And we're here to speak to you and the public about the Cape Cod Hoarding Task Force. I'm not sure if you've heard of us. We've recently just changed our
Yes.
names from the Mid-Cape Hoarding Task Force to the Cape Cod Hoarding Task Force to better represent all the towns that we're serving, which is every town in the county. There is a Mashpee Hoarding Task Force that does meet regularly as well as a Martha's Vineyard Task Force. I'm going to just read our mission statement to give you just an idea of our goals and objectives of the task force. And so the mission of the Cape Cod Hoarding Task Force is to sensitively raise awareness of compulsive hoarding and to provide education and support for those affected by hoarding through accessible tools, referrals, and resources. The Cape Cod Hoarding Task Force seeks to develop a coordinated response and to forge a cooperative arrangement among county, town, community organizations, and private services. So as I said, our task force has been meeting for a little over 2 years now. We meet monthly at the Dennis Police Department, the second Thursday of every month. And our members consist of public health officials, animal control officers, mental health professionals, social services, elder services. We have private professional home organizers, mental health professionals, fire, and private disaster specialists. We are a non-funded group. We're just a group that came together because we saw a need in the community. The county health department, I first came involved because I attended a training that was put on by Boston University, as well as Mass Housing. And they talked about the success and how effective having a task force and using a multi-agency approach is on this complex problem. As many of you are, I don't know if you're familiar with, but hoarding is a mental health issue. And from the county perspective, I became involved to essentially provide assistance to the local health departments. From my personal experience, I've seen health departments, building departments, and fire departments struggle with this problem for years, often unsuccessfully. So what our goal is to essentially come together as a task force with multi-agency, governmental and private agencies to find reasonable solutions to this complex problem. Some of the things that we've been able to accomplish in the short time is developing a website for resources, for community resources, as well as different websites that are available. We have developed a resource brochure, and we actually put together a very successful educational conference at the Cape Cod Community College this past winter that was attended by over 100 people, mostly professionals and residents alike. And we've done all of this without a budget. As I said, we're unfunded. We've just been able to be really creative. We've had some dedicated members and various in-kind contributions for the organizations and the members that are involved. And I just gave you a lot of information. And we just wanted to introduce ourselves to you and let you know, tell you about the work that we've been doing. Originally, we asked to speak to you because we wanted to set up or talk to you about setting up a county account so that we could take donations and receive funds. But since then, we've been able to use another avenue. We've actually coordinated with the International OCD Foundation. They have a local chapter here in Massachusetts, and the president has recently become a member of our task force, so we're able to use their account. So we don't have to ask you for that right now, but that might be something that we come to you or speak to you about at some point. But right now, we are all set.
And OCD is,
obsessive compulsive disorder.
okay.
And so no, your wife didn't contact us.
However, one of the things that I found was useful to me, because I am guilty of all of these things, was that if she's presented a very successful strategy of, people could use this stuff that's sitting over there. So in the last couple of weeks, because she's been more aggressive since we had a visitor from the department with regard to see if we had any mold. She suggested that I take all of the duplicates that I have of, VCRs and DVDs and so forth. So there are 3 shopping bags, I guess 4 shopping bags of VCR tapes that went up to my daughter, who was given the responsibility. She works for an agency in Bedford, so you could take it over there and you could show or use it with your patients. So I found that for me, if I feel that it's something that I have looked at and felt has value someday, that like the dryer motor that I kept in the basement for 3 years, and then the dryer burnt out, and I was able to take that motor and replace it. See, it's
A highly inefficient motor, I
Is
might
this
add.
making you
could
feel
have gotten
better
a
to get
much-
all this out?
yes, it is. Yes, it is.
But that is a source of why people
I'm
say it.
ventilating.
It is.
The
Yeah, absolutely
opportunity
is.
to ventilate, to admit to, to acknowledge, guilt, and hope that I'll continue to reform is very useful.
Good,
Doing
that's
God's
right.
work. honest to
That's
God.
right, and we do live in a society where it's very easy to collect an amount of items, or, sometimes you don't even have to leave the home. And the mail that comes in, the papers and things like that, it's very easy to become overwhelmed with the amount of stuff that people have in their homes. The clinical definition of hoarding is the acquisition of and/or failure to discard a large number of possessions. Living space that cannot be used for the intended purposes due to the large quantity of possessions and significant distress or impairment in functioning, including unsafe living conditions directly related to the large number of possessions. So we're talking about compulsive hoarding, where people have a stronger attachment to their items or their possessions than they do with other people. There's many reasons that people hoard things. A lot of times if they're mourning a loss of a loved one or family member, some kind of tragic event that occurred in their lifetime that's has enabled them to get to a point where they're just not able to let go of things. And people's living is impaired in their homes. So, we're just out there trying to reach out to these people. A lot of times, as I said, they are contacted, the health departments or inspectional services receive complaints, and then they can become involved. And what we've realized is until that mental health portion of it is addressed, you're going to be working with this individual for years to come. You may clean it up one day, but you're going to be back in 3 months, 6 months, or a year.
And we can go in and we can issue the order, but there's no resources for these people. Because it costs money to take care of the materials. Because some of the rooms are stacked to the ceiling. There's barely any paths. Could be on the exterior of the property as well. So it's the money portion of it. It's the mental health portion of it. And it's somebody to go in there on a regular basis and work with this person, because they can't make a decision. They can't make that decision to say, okay, you know what, these tapes can go to this place, they'll get used there. They don't have the capacity to make those decisions to remove that material.
I have no problem throwing out my wife's stuff.
There you go, there you go.
She has no problem throwing out my stuff.
So you can work together on
Oh,
that.
you're right.
That works.
Well, you know, how, I happened to face an issue like that with a person that I knew about in the town, and someone contacted me and to say, there's this problem this person has, and what do we do about it? And I didn't really know where to go or what to do, and this is 4 or 5 years ago. So I think this is a really great service to have. In fact, there was a program on TV recently, within the last month or so.
Actually,
about-
there's a series on board.
There is.
Yeah.
Oh, is that what it is?
Yeah.
I
Yeah.
saw one of the episodes, I mean, where it's
TLC.
where, I mean, the person couldn't move. And in fact, I think somebody died because they got so caught up in everything that was there, they couldn't get out of all the stuff that was in the house.
In my car, there's a copy of the book that they generated, if you wanted to look at it.
If they can find it.
So how are people really going to know about you and how to go, I know you have the website, but I think the thing is, how do we get you known to the general public?
Yes.
Because a lot of times, sometimes they'll go to the town, and if they approach a town or the county, then that's pretty easy, they can be directed to you, but how is the general population going to know that you're out there?
That's part of one of the
That's
things
why
that
you're
we're
here today.
reorganizing. Yeah,
Yeah.
this is part of it. We're issuing a press release about our new name change. And we do have a committee whose sole purpose is to get out there and get the image out there and get the word out there.
Okay, I tape on Mondays at 3 o'clock. If you would like to go on my program,
I
I'd be happy to.
help your program, okay.
I'd be happy to do that. This is a
Okay.
regional issue.
That would be great. I think I came and
As a
spoke to
matter
both
of fact,
ladies,
I have time this coming Monday, if you want to do that. We tape and do this.
I don't think I'm available this.
You're not going to the regionalization thing? That's Monday.
Well, that's right. That's right. I'm not going to be here on Monday because I'm going up to, thank you, to Worcester. Yeah.
I have my card.
Okay.
I want to mention something else, there is a cost obviously involved trying to remove all of this. Are there any resources that can help people with the cost of getting things removed from their premises? Do you know?
There's not a lot that
no.
we've found, but that's, again, another thing that we're gonna try to do is put together some joint service agreements and get some, maybe we get some clean out organizations that can, donate a dumpster or donate some of the time or something like that. And that's part of what we're trying to get together is how do we respond to these issues? And so it's still a work in progress, but we're making.
Because one of those programs that I saw, there was a young man who actually rented this house and had no idea that the person was a hoarder. And when they actually left, the house was a disaster. And it cost him a lot of money to clean it up and bring it back up so that he could rent it again. And it even showed what it looked like after the person left and what it looked like when he was all done. And he had to replace a lot of things in the house. So
Sometimes
there is
towns
a huge
are stuck.
cost to that.
Sometimes towns are stuck with that financial burden. If they had to condemn a home or remove someone from
Right,
a home.
exactly.
So that's another issue we're trying to be proactive to address so it does not get to that point. And we will be applying to grants and things like that of such. We did apply to one that we did not receive, but we are going to move forward with applying to more.
So are the
finances and
health departments in
resources.
the towns kind of the primary place for someone to go to get information or assistance?
So we would direct you to our website at www.hoarding.capecod.org. And then we have contact where you could reach out to us and send us an email. Up to presently, yes, your town offices or departments would be something that you could reach out to in your community. And also your council on aging. There's a lot of different organizations coming together.
I would suspect if you lost a significant other, and I know, and I give credit to Barbara all the time, because if she wasn't on my ass about doing this, I'd live in utter chaos. So I think that at a time when there's a loss of a significant other, that the hoarder doesn't have that motivation, but they say the partner motivation to let's say, to keep, pick up after themselves. So that's probably where you'd find it. Do you ever organize yard sales for people so that, so that they can give them a cash incentive without saying, because I know there's a lot of organizations that are always looking for fundraising opportunities.
Right.
And perhaps the two things tied in together, you'd have these people come in, they'd run a yard sale, maybe do a 50-50, as far as, by organizing, getting everything out of the house, putting it in the lawn, and then, selling it off, and then bringing it to the landfill afterwards.
But
or
then half the
transfer
battle is
station.
getting that person to the point where they're allowed to, they would okay you selling their items, so that's, sort of the part of the problem. But those are things that we're looking into, and different volunteer groups that we can pull together to go, and sometimes it's just a simple, going in and doing a cleanup of the yard, of someone's yard, that their yard has gotten away from them, and they just don't have the physical mobility to take care of it or handle it, things like that. So, I just wanted to share a success story with you that we personally were involved in with an individual on the Outer Cape, and this person had an enormous, and still continues to have a large amount of material on the exterior of his property. And we came together as a task force and talked about, kind of brainstormed on how to address it in the best way we could help this person. And we actually reached out to a professor at Cape Cod Community College and organized a cleanup, not a clean out, but a cleanup of this individual's yard. And we had 25 students on site, health officials, and this individual's family members cleaning up this property. And we filled a 40-yard dumpster in less than 2 hours. And
Actually, that was about
That's a
20
big
minutes.
dumpster.
It
That
took about 20
probably
minutes,
was-
and then,
Yeah, that's what I was thinking.
and the students really, the teacher said that they really got a lot out of it. They enjoyed the fact that they were able to help, and they learned a great deal about the whole issue. So I think it worked out well for them as well as the individual.
Did you want to mention this? It's probably geared for maybe public health people or
Yeah.
public safety, but
Yep, absolutely. Yeah, we have the training on legal issues of hoarding. It's coming up in November. We're still kind of finalizing some particulars, but it is going to be at the Harwich Community Center. And it's presented by Ann Anderson. She is a consulting firm, ADA Housing and Services. She conducts many trainings for mass housing, generally around the legal issues of hoarding. This presentation is, basically when does hoarding become a legal problem? When does reasonable accommodation come into play, and how to provide effective code enforcement? And one of the things that, especially as a health department, we kind of fight with is, what are our liabilities for producing the order, and what's our follow-up responsibilities, what's our responsibility for sharing with other agencies, et cetera. So hopefully we'll get some answers and help on the code enforcement side. And then also there's other areas, again, reasonable accommodation, if there's any.
what does that mean? Yeah, I'm not quite clear on what you mean by that.
Basically, if there's any, physical or mental limitations on the individual, we can go there and say, you need this cleaned by tomorrow. Is that reasonable? No,
Yeah,
it's
I
not.
see.
But there's also safety issues that you have to deal with, how immediate do those concerns have to be addressed, and then from there, where do you go? And the reasonable accommodation is just kind of working with this person, what's reasonable and what's not.
So it's not a case of you, as a health agent, not having the enforcement
No,
tools. It's just that they're not really all that useful
No.
because of the whole sensitivity issue. I know
Right.
you mentioned the sensitivity.
Right.
This program you're planning in November, do you plan to record it?
We're going to talk to Ann Anderson, and we're concerned that she is not going to want it recorded, just
Okay.
because this is her livelihood. She goes out and makes these presentations.
Because both at the community center and at the community TV outlet, these are the kinds of things that, that they would record,
Yeah.
while they were going on.
Mhm.
But in the meantime, let's arrange to have, let's say to give you some publicity in the next month or so. As
Absolutely,
Mark
yeah.
reminds me, we're going to be able to hold a class for
The regionalization.
the toolkit program on Monday, but the Monday after that, that
Okay.
would certainly be something.
Do you find that sometimes too that you have to reach out to other family members to help? Like if a person really does have certain disabilities either physical or otherwise, that you can't really force something on a person who's not capable or not able in some fashion to deal with it. So you have to go to some next of kin, I guess, that would do that.
Yeah, generally they're very helpful. You certainly hope they are, because they can actually, talk to the individual and maybe work with them to decide, okay, what are we going to do with this material? What can we,
Just send a confirmation.
make those baby steps to get the issue taken care of.
And sometimes too, it's just people who, I've seen some of these programs before where someone goes in and says, your house is a disaster, so we're going to do this in stages. And they have a plan where you put so much out, you put everything out in the yard and you sort it out, and then you say, this is going to go here and that's going to go there and whatever. And once they see it all out in the yard, first of all, they're happy that it's out of the house, really. And secondly, there's a way to actually dispose of it. And so you have to wait for summer for something like that, or fall.
That's
But
been my
anyway.
excuse for years.
Oh, Bill.
It's just not the right summer.
Right.
But there are times when individuals, they can't handle that much, and they can only deal with, say, an hour a week. They get maybe a half a garbage bag out a week, but it's progress, it's moving
That's
forward.
true.
It's, and that's just all they can.
That's how I felt about the VHS tapes.
And that's what you have to remember too about the television shows. I mean, that's reality TV. They're
Right.
compiling
Yeah, that's true.
showing this show in 45 minutes, and it's from beginning to end. We wish that these cases would move that fast, but it's not. And we do not recommend or suggest clean-outs, because they can be very detrimental to the individual involved. So that is not something that we practice, although it could be a tool. But a lot of times it does move much slower than it does on those television programs.
That's good to know.
Yeah, and we were actually contacted by that TLC,
Yep.
Buried Alive, to see if we had a case on the Cape, and we do know of a couple of individuals that could use a clean out. And they had a few discussions, and some videotapes were made, or some short videos were sent to them, and the problem wasn't bad enough, which to any of us, it would have been. I mean, this individual is not able to use their home as intended, because
Right.
they can't use their kitchen because of the amount of material, they can't use their bathroom because of the amount of material, but it wasn't that. So you need to, those reality TVs are just that, they're reality TV.
I had
But they're doing great.
one of my cousin's ex-wife was at that point where the newspapers in the house kept from getting, she basically had to have one door in order to get out, so I've seen that. It
Well,
can't be that bad.
you're doing great work, and
Yep.
it certainly is a need
And
for
get back
that.
to me.
And people who have the problem need help, and people who become aware of it need to know where to go to get some resolution. So that's really good.
That's right, so thank you
Glad
for
you're
your
doing
support.
that. Thank you
for the
for coming.
opportunity.
Yes,
Yes.
you're welcome.
And when my wife sees this program, she's going to be all over it.
She'll be calling
She
us.
will
huh?
be waiting for that email.
Thank you.
Okay, haven't we voted
We voted
the summary of actions.
So we voted the minutes. And I could point out that, let's see, since last week, I went to this committee, at the MMA, and
There's with Metropolitan Planning?
no, this is the Massachusetts Municipal Association.
Oh.
I'm on the committee for let's see, regional administration, municipal, anyway, it looks at regional issues across the Cape. There
No,
are
I know.
planners from Franklin County and from Berkshire County that I meet with, as well as selectmen, one from let's see, North Adams, and there's one from Belmont. In other words, they come from all over the state to look at it. And some of the issues that what we were looking at yesterday were some of the the areas for emphasis coming up. The designer threshold, selection thresholds, for example, where you would reduce the amount of money or increase the amount of money that you could pass as a board of selectmen in order to select an architect or a designer from $10,000 to $50,000, which is one of the things they're looking at. the acceptance of easements. You may know that unless you had a ruling on it, you have to go from town meeting to town meeting in order to get an easement voted on. They feel that the selectmen could do that. There's the mutual aid issues with regard to public safety. Although we think that might be something that is already taken up with the so-called fresh pursuit law. That's something.
Well, there's also intermunicipal agreements
Yes.
among the communities on if there were an episode in one community, the other, say, police department can go there and function in a support role. And then but the community where the incident occurred still retains control. And yeah, there's a lot of intermunicipal agreements on the Cape around that.
And we're very fortunate to have that. There's also the improving veteran services, which is something that's an ongoing thing. And I'm proud to say that Massachusetts has a reputation nationally of having one of the best state programs for supporting veterans, but there are some gaps, which I mentioned earlier when we had more on veterans. Emergency medical services, there is the issue of direct patient reimbursement, which the towns are very concerned with,
Right.
and
They wanted to go to the ambulance services.
Right, but they also are concerned about having the ambulance service set the rates. That's one of they might set it too low, so your reimbursement, insurance companies setting the rates, which might lead to a low, let's say, a too low a rate to support the cost of the service. So that's one of the things we're looking at.
Wait a minute. When you say the ambulance service, now in some communities that could be the fire department, where the rates would be set by the Board of Selectmen. But in some communities they don't have ambulance service; they have a contract for that, and then the billing would be done by whoever is contracted to perform the ambulance service. So is that really what they're referring to?
They're referring to the possibility that the insurance company would set the rate of the reimbursement rather than the service provider. This is something that needs to be looked at. The other piece is that they're having the fire service association come in at their next meeting, and I asked them to include questions about communications, as part of that, because I know that's an ongoing thing for us. The open meeting law, we do have a seat on the Open Meeting Law Review Committee, and there were several things that have come out at the end of August, which I've shared with you. The most important piece was the ability of the Board of Selectmen that is essentially chairing a town meeting to be able to discuss things and deliberate at the town meeting, which was something that pointed out that the promulgators of the open meeting law do not have any experience with the application of the open meeting law. So they had them go to a couple of town meetings, and it opened their eyes as to what actually went on.
Well, it's solvable if the Board of Selectmen posts a meeting and for the same time period as town meeting. And that would allow them to do that. That's all they really need to do. I think we did that in Falmouth.
Yeah.
That posted a meeting for the entire time of town meeting so that the board can meet and deliberate during the meeting, outside or whatever.
Apparently, of the 351 towns, more don't than do.
Don't do it.
Yeah.
Yeah.
But that's a good point. Let's see, liquor licenses, there's a cap placed on the number of available liquor licenses based on population.
Pouring licenses.
They think it's antiquated, and especially in places that have season.
It's package stores.
No,
There's a quota on package stores.
It includes package stores, but also restaurants are involved in this as well.
I don't think so.
No, on this one here, the cap on available lists is based upon population, and obtaining a home rule petition to override the cap is cumbersome.
Yeah, it's really only package store licenses.
No,
There's a
on
cap.
this particular, but
It's not on pouring licenses.
Oh, really?
Restaurants, no, you
Okay.
can have any number of pouring licenses, but there is a cap based by population on the number of package stores that you can have.
Then there's some confusion that I have, because when they
Yeah.
were discussing this, they were including pouring in package.
Well, they
Okay.
shouldn't include pouring, because anybody who has a restaurant can apply for a pouring license. So I can't imagine a cap on pouring, but certainly there is one on package stores, as well there should be.
Yeah,
Yeah.
otherwise it'd be one at every
Yeah,
corner.
that's right.
Okay, and
And
that's,
it's hard to deny a package store license. It is. I mean, the only option the licensing authority has in denying is the public good. You have to find some reason why having a package store in that particular area somehow just either not meet the public good. It can't be because it might be competing with a package store, 3 blocks down the street. That
Mhm.
doesn't work. There has to be some public reason, public good, that the license gets denied, and seldom does the ABCC.
it's interesting, if we define alcohol
Uphold those.
as another drug, that we were able to pass regulations that, that keep you from
Well,
having.
the reason I know that is years ago, a gas station opened up in Falmouth at the corner of Route 151 and Sandwich Road.
Mhm.
And it was a gas station, and they had one of those little kind of superettes, or whatever they call them,
Yeah.
the little convenience store. Well, the convenience store wanted to sell beer and wine.
Mhm.
They wanted a package store license. And the Board of Selectmen denied it on the basis of, first of all, that the customers that they would be receiving would be people who are traveling, who come in to buy gas, and then they would go in, and so they're gonna get back in their car and go somewhere else. It's not like they're getting in their car and, so anyway, it was the idea that because it was the traveling public who ought not to be buying beer and wine while they're traveling and getting back in their car and going somewhere, they actually, the ABCC upheld it, the denial. And to this day, there is no package store license at that location. Interesting.
It is interesting, because I've lived in states that you can buy beer and wine at the gas station.
Yeah, well, you could if it seemed like an appropriate thing at that point,
Mm.
but in that particular location,
Yeah.
it was the traveling public that was being served.
Well,
So, well,
and-
that's good. I'm glad to see they're working on that.
And I sent you the, the minutes from the meeting.
Yes,
so
yeah,
you
that's
also
really
have that.
helpful.
Yeah, and I've enjoyed this committee a lot, because if we're looking at, things that have regional impact, at least I'm in
Mhm.
conversation with the other two regional governments, people. So it's been an important connection. That's about.
Well, I had something, I heard a presentation last week of a young woman in her early 20s. And do you remember when the tornado went through Monson and destroyed the town hall and everything else? Monson had emergency planning like most local communities have now. But what happened was there was no way, because it was so destructive, that people either lost their homes, lost everything they had and were out on the street with nothing, or there were people who didn't lose their homes and were out on the street because they wanted to help. But there was no way to coordinate either help for the people who needed it or help for the people who wanted to provide help. So this young woman and her friend just got together, the two of them, and they organized this whole disaster, if you will, from the resident perspective, the citizen perspective, not from the services or from the town or whatever. And as a result of all of that, they created a website. I think it's called, I didn't bring it with me because I only wanted to briefly mention it today, recovery.org. They have made, they've developed a complete plan for any community when they experience a disaster like that, either sometimes less or sometimes even worse, of how you organize your community and how to communicate with them and how to make it happen so that people who need things have them, and the people who want to share and help have a resource. And even to the detail of if someone's home was not destroyed but damaged considerably and had, say, a leak in their water system, in their plumbing somewhere or other, someone could go on this website and enter the location and all of that, and what the problem was, and it would immediately give you a list of the plumbers who were nearby, and you contact that plumber and you get somebody there to your house. I mean, this is really good, and I would love to have her come and have Sean O'Brien here and just have her talk about how they have taken this to a new level.
Yeah, maybe we
It's
should
wonderful.
get Sean and our REPC to look at what they've done and see if it is different than anything we're doing already.
Oh,
So-
believe me, with all the disaster planning I've been involved with over the years, I have never seen anything as sophisticated as what these two young women
I
put
think you
together.
brought up the most important point was from the residents' point of view.
Actually, yes, it's
Because
from,
I was at a patient and family advisory committee meeting at Cape Cod Hospital yesterday, and it turned out that we had a discussion of a mock-up that they put together of an ICU, and one of the points that that our committee made was that you had the people that work here go through and talk about the efficiency as far as operation,
right.
but you didn't have any patients come in to see how what does that mean to them, because there are from the point of view of the consumer, they could have an important impact on how you put this together.
Well, what I'm going to do is, the next meeting, I'll bring some of the materials and
Okay.
we can take a look at them and see if there's any relevance to that and the regional piece, because it could be that maybe it's more important for the individual communities to be able to work with something like that. But anyway, it was an hour-long presentation and discussion, and it was pretty amazing.
I think that's great, and
Yes,
and I think Sean and his committee would benefit from it.
I would think so. I mean, this whole website, and it can work anywhere in America. You put your town name and
Yeah.
recovery, and it also has a whole lot of information about the town itself. So anyway, I'll
That's
bring all
great.
that the next time, because I didn't bring it this time, because I didn't think we'd have time to talk about it. So we will move on to our 2 o'clock agenda item, which is the letter that we received from the town of Sandwich. And we have here a member of the Board of Selectmen, Frank Penorthi, from the town of Sandwich. Frank, welcome, we're glad to have you. You want to come up
Yeah,
and
come on up and join us.
sit up front if you like?
That wasn't my intent, but.
No,
By the
but
way, the last time an alarm went off in a meeting you were at, it cost me $5, but that's
I
the
remember
worst.
that.
Yeah, and
Well,
Randy never lets me forget it either.
the reason I put this on the agenda, this letter was sent to the county commissioners on August 24th, 2012, by the Board of Selectmen in the town of Sandwich. And it's in response to the concerns we all share about wastewater planning on Cape Cod, both wastewater planning as it's being done by each of the individual towns, and wastewater planning as it's being done through the Cape Cod Water Protection Collaborative and the Cape Cod Commission, and how does all this fit together? And the reason I put this on here, on the agenda, mostly was because I thought it was important to acknowledge that the Board of Selectmen took the time to really do a very thorough review of all the efforts that they've made for the last few years in terms of wastewater planning in Sandwich, put it together in a way that was thoroughly readable and understandable without missing a point. And also at the same time saying, look, we recognize that the county has been involved in many different efforts in the area of wastewater planning, and we appreciate what they're doing, but we want them to understand too that we're doing our part, and we may be looking to the county to be supportive and helpful in different ways. It could be in financing, it could be in providing models of being able to survey or review what some of the problems are, but it's certainly, Linnell,
Hi.
welcome. Want to sit up front? Linnell Grundman,
Sorry,
another
I'm
Sandwich
so
Selectman,
late.
welcome.
Did I get here right in time?
Glad you're here. We're just started.
Good,
And I was
good.
just saying that the reason I put this on the agenda was
Okay.
because the selectmen took a great deal of time to very thoroughly respond to the issues of wastewater planning and to let us know what has been going on in the town of Sandwich for a long period of time, what they've accomplished, what the board has accomplished, or the town has, and what their view is in terms of the future. And I thought that deserved acknowledgement because it was such a
We do
well-written
appreciate
letter.
Well,
And
thank you.
it was a
You're
learning.
looking at the co-authors here.
But also, I mean, I learned a lot. And I
Good.
thought this is something that
Great.
would be very helpful for us as county commissioners in doing our planning in terms of being able to be responsive to the towns and say, how can we help you? We're not going to do the job for you. We're not going to do anything to interfere certainly with what you're doing. We want to be helpful, we want to be supportive, and if there are ways in which we can do that, whether it's through the creation of tools, like the Cape Cod Commission is now coming up with that MVP, multivariate planner, that anybody can use to take a look at wastewater and what the options are, what the tools are, how much nitrogen can be reduced and what it's going to cost, to if there's some model that we can come up with that would provide financial support. I don't know what that would be,
Yeah.
but certainly not a taxing authority,
Right.
and certainly not taking over the planning and implementation of wastewater in Cape Cod. That's not our intent, and it's not our job. Our job is to work with you and support you in your efforts. So,
As we said in our letter, we've given you kind of a history.
yes.
And it wasn't complete. As many things as we listed, it wasn't complete. I could have written 4 more pages probably, and Linnell as well, on what we've done over the years. That wasn't the point. The purpose of the letter really was to have a bottom-up kind of presentation of not only what we did as a town, and I suspect other towns in a similar situation, but also tell you how we see it from our point of view of how we see the collaborative, the county helping us. 2 things stick out in my mind immediately. Technologies, which are changing almost daily, number 1. How are we going to finance these things? Because you know as well as I do, and these folks out here who live on the Cape, in some towns these things have passed, in some towns they've been defeated, okay? We've taken a slightly different approach. As a matter of fact, this Thursday night, tomorrow night, we're having a law firm come in, and it's a special meeting that we set up, selectmen's meeting, it's an open meeting, just to hear one law firm who has been very involved in the financing end of these kinds of projects. Our own council will be there because they have extensive experience, because these are the things that we're going to have to start considering.
As well, our Water Quality Advisory Committee will be there too, because our Water Quality Advisory Committee, which I serve on, I also am vice chair of the Cape Cod Water Protection Collaborative. So I think what was timely about Frank's concern was kind of my expertise at this point in terms of the issue. So tomorrow night, we will have our Water Quality Advisory Committee there too, which is acting as a steering committee. We're halfway through our comprehensive water resource management plan. We have not, that work has not evolved into funding conversation because we don't even have the draft plan in front of us.
Right.
But our selectman chair wanted to bring this firm in, so we've got the Water Quality Advisory Committee coming as well, because I wanted, and that is a double meeting. I think what's really important about this issue, and I think what happened at our board was a really good illustration of a healthy dialogue. Frank's concerns about what the role of Cape Cod Collaborative was, and of course you guys know this because you charged the Cape Cod Commission and the Collaborative with doing outreach these last few months. Frank's concern was that we send a message to the county, and that's where the idea of the letter came from. That we've considered that the 4 entities involved in talking about the policy, creating the policy, implementing the policy, funding the policy in terms of county budget were the commissioners, yourselves, the Cape Cod Commission, and the Assembly will have a role in that, and the Water Protection Collaborative is purely advisory, but it was created to bring the voices of the towns to the discussion. So I think we're kind of, we don't want to take, we're kind of ahead of the curve here, but I know that as a member of the collaborative, that we're also hoping other towns will take similar steps to be very clear and feedback to the county, because it is, I think those 4 entities are the entities that need to hear very clearly where we are, what we want, what we need.
And that's the value that I see in your letter, is that it's a form, it's a way to educate not only us, but also all the other communities in terms of what you're doing. And we don't know in many respects what other communities are doing. Sometimes we do because we've been more involved with them, particularly like with the town of Chatham. I mean, the Cape Cod Commission has been very involved with the town of Chatham, with Orleans, who really are still working very hard with the town of Falmouth, who's now completed its CWMP and is going to be under review by the commission very shortly. But you also, the other thing you say in your letter is that you have remained informed through your representatives on the commission, Cape Cod Commission, and the Water Protection Collaborative, which is good because we find that some communities have their representatives there, but there's not always that opportunity to engage in a discussion with those who would. Maybe you want to talk about that.
I think that's very important because, and I think it's kind of surfaced primarily because of where we are with respect to the consultant work. We're about halfway, would you say, Leno, into something what we think to be somewhere between 3 and 3.5 years, you know, of a study made. Part of that study, and we're all aware of this because you've all been involved in it as well to some degree, is waiting for the University of Massachusetts to complete its work, which is a key component. You know, we live on the Bayside, Sandwich is on the Bayside. We have 2 primary estuaries, okay? And anecdotally, we've been told, we don't think that there's a problem, okay? We cannot move forward with our future planning in terms of this work that's being done by Wright Pierce, our consultant, until we have the answer to that. But as Linnell said, I hope that what this letter does, and I don't know whether it's your first letter, second, third, whatever. If it is first, I hope it's really a catalyst for the other towns to do something similar in terms of writing. I don't care what they write to you, you know, in terms of what their position may be or what they've done. I suspect from a standpoint of the work that they've done, probably a lot of them have done the same work, but have not recognized necessarily as being able to improve the quality of the water.
Yeah, and they go together. I mean, the water quality and the wastewater. I mean, when you think about it, your drinking water and how you handle wastewater are very much connected.
I have to say that the collaborative, I came on the Water Protection Collaborative when the collaborative made a strategic move to bring selectmen on the collaborative. Prior to that, there were just basically boards of health, and of course you have a representative on the collaborative too. And I think that was a good move. So I've actually seen how that has evolved. It's been the time that I've been there. And I think that what we did definitely has a lot to do with what the collaborative would like to see happen. I'm not telling anybody they have to write a letter, but I know that this is a complicated, that one aspect of the complexity of this issue is the dialogue moving us forward. And so the more feedback we get, I think as a county, the better off we are, because then we have a clearer picture of what the reality is of the boundaries that different towns may be concerned about. We all know that funding is going to be a problem. But we have to also recognize that the towns are at different places. So what I like about what we did is we just talked about a lot of things that I talk about all the time, but differently and from a different perspective. And we directed our comments to a specific four organizations, 4 governance bodies that will be key to the county planning on this. And we have a selectman who I really appreciate. He constantly reminds our board that we're not just talking about regional planning, we're talking about regional solutions. And I think that's an important thing to remember. When you put it in that context, it is important that towns know what they've done, but it's also important that we just all pay attention to the fact that there's something positive in the outcome. And so we're just happy, and we're also very happy it was well received by you.
Oh, well, why wouldn't it be? I mean, there was a lot of work putting this together.
From one point of view,
very
the fact
informative.
that you were willing to put the time and energy in the development of your comments demonstrates better than anything else your interest and commitment to the solution. Because
thank you.
Because we have much to learn from the differences that come out, and if we don't, and it's been a contention of mine, you have to have everybody in the same room at the same
Yeah.
time in order to come out with a solution
It's so true.
that we all, you know, that we all agree on.
Yeah.
So I'm delighted to see it personally, and
Thank you.
and I would charge you as the vice chair of the collaborative to encourage the other selectmen representatives from the towns to come up with what I would call their inventory of, let's say, of results to this point and their anticipation of activities going forward, because I always thought that that was the basic reason why we put the collaborative together, was to find that out.
Right, well, and frankly, that happens, you know, that is the most important of our conversation. I don't want to get ahead of where we are, but the steering committee, this is definitely part of what we'll be bringing to our governance committee. Next week, I think, is it next week we meet? It's next week we meet. This is the top agenda. Because we realize where the outreach was well-intended, that we haven't gotten maybe the result that we've needed. So the collaborative's on top of this. And as I told the chair yesterday, we're already done. So we've already done what I think the collaborative will be, formally asking their members if they support an activity that will include this sort of thing, and with a short turnaround, with like a month turnaround, so we can start to collect this, collect these views, collect this picture, frame the issue this way.
Well, for me, I remember, Bill, some 8 years ago when you came to Sandwich with Tom Bernardo.
Yes,
It wasn't a good session necessarily.
There's a lot of energy.
I was
energy in the room, as you say,
Energy.
and it's come a long way.
Yes.
We, at that time, were skeptical, quite honestly. But we recognized that even with our skepticism, we needed to have a seat at the table, a point that you made very well. Otherwise, you know, we wouldn't know what was going on. And from our perspective, it's grown. It's gotten to this point. I hope it changes from a standpoint of other towns doing something in terms of letting you guys know, letting the Assembly know, letting the Cape Cod Commission know, and letting the Collaborative know that here's where we are, here's what we think, here, you know, and whatever else they feel important to say.
You know, there is a military aspect to this, and it's very simply this, is that unless we know what we have in terms of resources, unless we know where, you know, where the inventory of activity is, if we don't know where we're at, we don't know, we won't be able to get to where we want to go.
Right. The complexity, though, is, and this is why we directed this letter to the 4 entities that will be involved in policy making and budgeting and so forth. There's a huge political piece to this that we all know and are aware of. But when you have to find a solution and get through the political piece to get there, it does become more complex. So I think in addition to knowing what we have, which is rapidly changing, what I've discovered on the collaborative in the almost 3 years I've been on it, things are changing so fast. One of the things that does change is when a town puts tremendous effort and time into finding a solution, then of course it gets rejected at town meeting. Where are they? So that additional complexity to this issue, I think, is our challenge. And I think that this kind of clear communication from one town to the entities involved in making those big, broad decisions about policy and strategy, I think it's a step in the right direction. And I know this is the collaborative view as well. So we're getting there.
That's two.
Yeah. Well, I mean, I couldn't stress enough what you just mentioned about the public outreach and having opportunities along the way for the public to be brought up to date and have some input. I know that that's why things don't pass on the ballot, is because people don't, either they haven't taken the time to know, or that time hasn't been provided.
Or sometimes it's a question of how the outreach is conducted.
Yes.
We've discovered in our town that we're hoping to change that dynamic. If outreach is conducted as a sales job, then how effective can it be? I think that particularly where there is an issue like this, which is so highly complex and costly and goes on at this point because federal funding and state funding is non-existent, the solution looks to be that on the backs of the taxpayer. So I think that we've come to a point where the outreach has to include as much information as possible, but cannot presume to know how people are going to receive it. It needs to be a dialogue. And I think that people, I like to say this, Frank heard me say it many times, people are smarter than they ever were before because they have so much information at their fingertips. We still may not talk like we're that smart, but I think when it comes to government, people really want facts, they want to be heard, and they want the opportunity for dialogue. And I think that's going to be key to
It's
this.
almost like a 12-step piece where you can't have the arrogance of believing that you know what the other people, what the other person is thinking.
I think you're right.
I know, one
I think
thing
you're
that
right.
worked with the Water Quality Management Committee in Falmouth was having the Consensus Building Institute conduct 3 public forums where
That's great.
they had someone who was
Objective.
a facilitator, they had someone there who took notes of everything that was said, and the committee just simply was there, was present. It was interesting because the first meeting they had, there were about 20-some people there. And then maybe 6 weeks later, they had a second meeting and there were maybe 50 people there.
Wow.
And then the third meeting, which was maybe another 6 or 8 weeks, 2 months after that, I've forgotten how long that the space was in between, there were probably 200 people there.
Oh, that's phenomenal.
So over time, people became aware, there was a lot written in the paper about it and how many showed up and didn't, and finally people really got to understand what it meant to them. And they really wanted to have their say, so there's some value, I think, to that. And
that
having it
objectivity.
facilitated by a real professional.
And somebody objective, I
And
think.
totally
That's a
objective.
phenomenal success story.
It is,
That's
yeah,
great.
it is.
Wow.
That was the committee that decided that was the best way to do it. And actually, it was a good way to do it. Because, anyway, so, but it also turned out in the end that when it was approved by a town meeting unanimously, and then it was approved on the ballot by the highest number of votes ever on a ballot
That's an
question.
accomplishment.
That tells you something right
And that
there.
tells you,
Yeah.
because the public outreach is just so key
It
to
is.
making it work. If people don't know, they're not gonna vote for it.
I'm going to take this back to the Water Quality Advisory Committee, because I think the key there is that objectivity and the facility. And of course, I spent 10 years on Capitol Hill, and everything's facilitated,
Right.
And I was shocked. It's a process that I wasn't familiar with, but I'm definitely bringing this back to our group because that is very key. That you have to trust the people who are facilitating it. They have to be professional, and their goal is not about one side or the other. Their goal is about facilitating the best conversation.
Yeah, and making sure everybody has an
Yeah, that's
opportunity
great.
and getting the right information and asking the right questions.
That's just great.
Yeah, so put that in
I
your
am definitely going to
file of something to think about in the future.
Well, we thank you.
Well, thank
for
you.
your
We learned a
comments
lot
on the
from
letter.
reading
We
your
appreciate that.
letter, and I think others will as well.
Well, thank you for acknowledging it,
All
for
right.
the opportunity to have the.
And you will share this with the, good to see you, Frank. You will share this with the collaborative, right?
Absolutely.
Okay.
Next week, as a matter of fact.
Mark,
Thanks,
my
Lynell.
pleasure.
It's always a
Bye.
pleasure, Frank.
Thank you.
My pleasure.
Nice to
Frank,
see you.
so
Always a
much.
pleasure. Thank
Thanks.
you.
Thanks.
See you. Bye-bye.
Bye.
Well, other than signing stuff, I guess that's it.
I think.
Well, I have a couple.
Oh,
things.
yep,
Okay.
Mark's report.
I'm asking you to sign a transfer resolution to the Assembly that we'll submit today for AmeriCorps. As you know, we put $48,920 as a match in their budget every year. And then when they realize how they need to spend it, we transfer it into the appropriate salary account, so there's that. You have been invited by the town of Brewster to an award ceremony for the Coastal America
Oh, yes.
Partnership Award. That's September 21st from 1 to 4. It's going to be at Cape Cod Museum of Natural History. It's for the Stony Brook Salt Marsh and Fish Passage Restoration Project. So you can put that in your calendar.
And where is it again?
It's at the Cape Cod Museum of Natural History.
And the Stony Brook is kind of across the street from.
Yep.
where the-
Yeah, I know where it is.
You may have or may have not noticed that they're working on the summer stage
No, I did not
construction.
know.
Oh,
Although I've been up there.
So it'll be next summer stage.
next summer stage.
And they should be completed. They're scheduling the dedication for October 6th at 4 o'clock. Hopefully they'll be done by then.
October 6th.
It's the summer stage that we're doing up there on the hill.
So they'll be ready to do that in October, that's good. So they
Yeah.
will be ready for next summer.
They'll be ready for next summer, yeah. Joni Ellis asked permission, which I have granted on your behalf, to put the little flags that she does
Oh, yeah.
on 9/11 next Tuesday, Patriots Day and Veterans Day.
She does a nice job there.
And I did receive, we received a letter from Cape Cod Mosquito Control.
Yes.
So I scheduled that for our meeting of September 19th at 2:30.
Okay.
So we'll have mosquito control come by and talk about becoming a part of the county family.
Interesting. Well, they give us something ahead of time, so we'll have time to review what they're gonna talk to us about. You know,
Yeah.
it's really helpful, I think, when there's background information that we can get ahead of time, so it moves the discussion along a little better.
Yeah, you know, the board invited me to one of their meetings, this was a few months back now, and I went. And so I do think that there is a sort of preliminary prospectus, I guess, if you will. So let me see if I can dig that out.
I think that would be helpful, because then we have some idea of how that, we'll have some idea ahead of time to know what questions to ask,
Yeah.
what they're looking for, what should be included, instead of just having it in front of us.
Yeah, okay.
All right,
That's it, that's all I have.
that's it.
Yep.
I don't have anything else.
I don't either.
I'll move to adjourn.
Second, all those in favor?
Aye.